Department, saying that it's not yet time for a shift to alert level 4.
Mukhang hindi na kailangan sterile kasi yun nga, lalo na kung medyo baka malapit na yung peak at yun nga, medyo as you said, bumababa na yung hawaan from 6 to 4. So baka hindi na kakailanganin yung alert level 4.
Itong alert level 3, nakakatulong talaga, no? Kasi mapapansin nyo kahit sa traffic, sa mga establishment, o sa mga outdoor, nakikita mo talagang mas ano na ngayon, hindi na lumalabas ang tao, natatakot na rin, no? Kaya medyo nag-lessen ng mobility.
The Education Department has allowed the suspension of classes in COVID-19 high-risk areas as government prepares to vaccinate next month. Children aged 5 to 11 years old, 54 areas around the country are now under alert level 3. But will all these measures control COVID-19 transmission? We discuss in this episode of the Chiefs. Welcome to this edition of the Chiefs. Ako po si Robbie Alampay. Kasama ko po online Ami Pamintuan of the Philippine Star, Lucy Cruz Valdez of News 5. Chiefs, good evening.
Good evening.
Good evening.
Hi, Lucy, Ami. Anong balita?
Well, medyo good nga, no? Dahil medyo, sabi ng Okta, mukhang nagpa-plateau na yung cases. Although, syempre, abangan pa a couple of days. Saka yung mga business group siguro, masaya na hindi nag-alert level 4. Yun lang naman na hinihingi nila eh. Although alert level 3, tatagal pa until the end of the month.
Tsaka nilift na yung ban, no? Kahit sa red list. Oo, parang nagluwag na. Tsaka pati mga foreigner, basta fully vaccinated, no? Pwede na pumasok. So, pero not for purposes.
Yes.
Not for tourism. So maybe mainly for business at saka yung mga kababayan natin na gustong umuwi. Pero meron akong nakikita isa pang gulo. Wala pang tigil yung gulo dyan sa transportation. Kasi ngayon magkakaroon na ng secret marshal. Hindi naman secret marshal ang tinatawag. Pero
Mystery passengers. Hindi secret marshal ang tinawag.
Siyempre, ayaw nila secret
marshal ang tawag. Pero di ba, yun ang nakakatakot kasi I can imagine a lot of confusion, a lot of chaos. Paano kayo magpapakilala? Sino magpapakita ng tsapa? Tapos on top of that, yung mga jeepney drivers and operators, they will carry the burden of being responsible in validating kung
nga nila
yung vaccine cards.
Hindi nga daw nila alam kung paano nilang i-validate.
Talaga. Baka mamaya may magpanggap pa. Mag-power trip.
Yung RT-PCR, pina-fake eh. Hindi yan.
Okay, paano kung magbolahan kayo? Paano kung ikaw yung nahuli na walang vaccine card? Tapos sabi mo, hindi,
mystery passenger ako eh. Kaya nga eh.
In the meantime, let's go to one of the things that will hopefully meron tayong kalinawan, but there's also still a lot of questions, of course, sa education sector natin. Alam naman natin, there's going to be a 2-week break para sa ating mga guro at saka mag-aaral. But let's find out kung merong mga gusot dyan at saka kung merong mga kalinawan dyan. Let's begin tonight with Undersecretary Wilfredo Cabral, Regional Director for the Department of Education. Yusek Cabral is also the OIC Undersecretary for Human Resources and Organization Development of DepEd. Good evening, Yusek Cabral.
Good evening, Yusek.
Good evening po, Yusek.
Good evening po sa lahat.
Yusek, maybe talk to us first about this break that we all agree everybody deserves, but everybody's also asking, gaano kahaba ba to? Is it contingent on numbers or is it really just strictly a break? Kasi alam naman natin, nasa kalagitaan din tayo ng surge. Maybe let's start it off with explaining to everyone what they should understand about this upcoming break.
Well, there was a call for a break but we would like to emphasize that we have this academic is implemented in the Department of Education, and so the central office issued a memorandum allowing the suspension of classes, and considering the surge in COVID-19 cases, particularly in NCR and in areas with heightened alert level 3. So we would like to emphasize that this suspension of classes is allowed because we recognize the fact that there are students and learners as well as teachers who have been demonstrating symptoms, flu-like, and there are those also who tested positive. And binigyan po ng pagkakataon ng central office ang mga regional offices and division offices na evaluate ang kalagayan ng mga division at magrekomenda ng pagsususpindi ng klase kung kinakailangan. In the National Capital Region, we registered that based on the survey conducted by our superintendents, many of our students and teachers are exhibiting symptoms, not necessarily positive, but they have these flu-like symptoms, and we would like also to provide assistance to them by declaring the suspension of learning activities and classes, even it is on the distance learning modalities.
Pero
But
Yusek,
even
linawin na po
before
natin
you
na
announce,
hindi pa po to nationwide. This is still depending on LGUs and actual communities.
Well, it's not a nationwide suspension.
NCR.
Only those areas with level 3, alert level 3, and based on the honest assessment of the superintendents.
But even before the academic break, no, that
Yes, ma'am.
imposed by the DepEd, marami na rin po talagang nagsuspende, no, ng mga klase. In fact, maraming hindi pa bumabalik sa klase mula nung Christmas and New Year break, no. Ano po ba ang leeway ng kanya-kanyang mga paaralan para mag-impose ng sarili nilang mga timetable for when to return to class, when to resume online classes? Pwede ba silang lumagpas dun sa sinet ninyo na hanggang January 21? Can they go beyond that?
Narinig ba kayo?
Sir,
Yusek,
did you hear me?
It's inaudible. I'm sorry. I did not hear the
mahina.
question.
Oh, I'm sorry. I guess my question, Yusek, can you hear me now?
It's distorted.
Can-
I'm sorry.
Distorted
It's
daw.
distorted. Siguro ikaw na lang, Ami, baka
I think
naririnig
my
ka niya.
connection or
Yusek, naririnig ninyo ako?
yeah. Clear now, ma'am.
Yes, tinatanong
Baka ako,
ko kung ano yung leeway ng mga schools to suspend, kasi sabi niya since Christmas vacation daw yung marami na ring schools na hindi pa actually bumabalik kasi Omicron nag-umpisa mga start of January eh. Ano ba yung leeway ng mga schools to decide kung tatagal pa? We understand mga hanggang 22 yung karamihan eh, di ba? Ano po yung leeway na, ano ba yung sa discretion ng school administration?
Wala i-extend yun?
Yes.
Well, the discretion for private school is for them to consult with their respective parent teachers association, and that discretion is given to them. But for public schools, we decided the time and the date of suspension, and for NCR in particular and in Calabarzon, they decided to have their suspension for a week because the memorandum issued by the central office should not be more than 2 weeks.
Yusek, ngayon lang kami nakarinig ng academic health break. Meron na ba kayong initial figures kung gaano karami yung mga affected sa teaching staff, at least sa government, sa DepEd lang muna?
Well, we're not actually using the academic health break. We're using the academic ease. Early on, we're saying that should be the platform. But the suspension of classes in similar ways with that of the typhoon signal, meron po tayong sinusunod na protocol. And pre-pandemic, the suspension of classes where learners are reporting physically on-site, we are compensating that by makeup classes. But since this is a distance learning, we call it class suspension, in fact. Class suspension.
Yung sa
Anong
kanina po, dalawa
effect
yung
dito,
nabanggit
sir?
nyo, no? Of course, yung consideration natin para sa health and wellness ng ating mga guro at saka mga ano. At the same time, you said, in consideration also of the ongoing search. I guess ang tanong ko po is this just contingent on the need for a break for our academic community, or is it also contingent on the numbers? In other words, paano kung hindi bumaba yung numbers, and for that matter, kung sa ibang regions tumaas pa? Maaari po bang humaba pa tong break na to?
Well, as much as possible, we would like to make it contingent for health so that they can recuperate. Meaning to say, as I mentioned earlier, we cannot really anticipate a prolonged extension because that would have an impact also on the implementation of the school year. And that will affect the preparation for the next school year, and knowing the fact that our teachers will also be involved in some other activities
In the elections, in particular.
particularly in the election. And at the same time, nobody can predict what will happen in the next 2 to 3 weeks. But what we are trying to be ready with is to ensure that the distance learning will continue regardless of the alert level. Meaning to say, we will intensify and prepare that asynchronous learning will still happen, and that the submission of the requirements of our learners can be done either online or in whatever modalities that can be decided upon by the schools, so that the contact and the contamination can be mitigated by such approach. We are actually doing that right now, because we cannot afford to add another week based on the recently issued updated guidelines as well on the quarantine and isolation. The 7-10 days is sufficient for those who are exhibiting and those who are asymptomatic as well. So probably that can address the problem, ma'am and sir.
So tuloy.
Ma'am, sir, ano ang epekto nito sa calendar ng school for the school year? So are we seeing na baka a good part of summer will be spent finishing the school year? Sir, narinig ba ako? Parang hindi, ano?
Sir, naririnig niyo po ba kami?
Medyo nawala po si Ma'am Lucy.
Yusek, ang tanong po ni Lucy, how does this affect the calendar for para sa ating mga paaralan?
Yes po. We're expecting that the quarter 2 will end by 29 January, and the mid-year break will start at February 2 to 7. And we have this Feb 7 as the onset of quarter 3. So when we suspend classes from 17 to 22, the number of days that will be taken away from the calendar is 9, and that is sufficient, including Sunday, that's 10. And we're looking at the makeup classes in terms of remediation, enhancement that can also be done asynchronously, so that this will have no impact on the additional number of days on that, because the calendar will end by July of 2022, and with that, we can manage to find the number of days to be sufficient for the calendar. And we will start quarter 3 by February 9.
Meaning yung makeup classes po ninyo will be weekends, hindi kakain dun sa, hindi lalagpas
Yes.
dun sa school calendar.
Yes, ma'am. Yes, ma'am. That's what we're looking at. That's what
Yes.
we're looking at.
Yung
Okay.
expansion ng face-to-face, kasi balak ninyo, di ba, ituloy by January 31? Matutuloy pa kaya yon, seeing what's happening now?
Well, I am not at liberty of discussing the progressive expansion because our USEC Malaluan is handling the team and they have the consultation with the DOH counterpart. But the suspension of limited face-to-face is only on alert level 3, meaning to say those who are in the minimal and low risk can still continue as long as they are in level 1 and level 2. And it's good that if we can continue the expanded phase in those areas, then we can have a benchmark on how we can really adapt the limited face-to-face component in the blended learning.
Ano po ba yung reaction so far dun sa generally, syempre maganda yung pilot ng face-to-face. Maybe you can tell us more about it. Kung ano yung resulta nung so far, yung nakikita nyo.
Well, based on the survey that is currently being prepared by the Office of the Planning Service through the leadership of Director Roger Masapol and with Yusek Malaluan at the helm of this, we are happy to note that the limited face-to-face is successful in terms of how our learners, our parents and teachers appreciate the implementation and how the learners are feeling safe in learning with their co-students and learning in school with their teachers. But of course, we look also at some of the challenges that came up. This will be part of the report that the DepEd will be submitting to the President.
Yusek, bago po natin makalimutan, kumustahin ko na lang din po yung mga nasalanta ng bagyong Odette. No, alam naman natin, tumama ito ng matindi sa Visayas, sa Mindanao. I'm wondering, ano po yung sitwasyon ngayon ng mga estudyante and for that matter, our schools, especially given that, everybody still again, back to having to rely to online learning. Ano-ano po yung mga facilities at mga kagamitan na hanggang ngayon mahihirapan silang bawiin?
Well, even learning resources were affected and the regional offices have already extended assistance to affected regions financially for the personnel. And we are also realigning some of our resources for non-affected regions to augment for the need of our affected regions. In fact, there were funds that were realigned for them to support their distance learning.
Okay.
Ako yung mga teacher, kumustahin ko, sir. Dahil syempre kung apektado rin sila, no? Pag pinagpatuloy na yon at kahit pa online yon, I would imagine na yung absences will still be high. Lalo na po yung, kasi di ba I mean, it's not fully online, hindi mo ba? Lalo na sa regional areas, meron sila nung modular, di ba? Tapos naghahatid yung teacher ng mga modules. Paano po kaya yun? How are you coping now with many of the teachers probably experiencing long COVID? Or is there an alternative plan for those absentee teachers affected severely by the COVID when school continues in January? I mean, on January 22 onward.
Well, for those who will be experiencing continued effect of COVID, we were looking at team teaching and
Team teaching. Paano
yeah,
po yun?
ano po, there are those teachers who are working with their counterpart in a school. One has been doing online and the other on the asynchronous. Or there are also divisions who hired learner support aides, and we allowed that by the issuance of a pertinent memorandum allowing for such, and utilizing also fund under the flexible learning options to finance that. So if there will be instance that they cannot really report or
Mm-mm.
attend to their task, since the module are already in the possession of our learners, and hoping that there are adults in the household that can help, the submission and completion of quarterly assessment should be the basis for meeting the standards on a particular learning competencies in a given learning area, ma'am.
You said,
It must be.
seeing what's happening now, meron na ba kayong na-receive na expressions of concern from teachers about doing election duty? Kasi baka magka-problema na naman yan, di
Oo
ba?
nga.
During the election season. Meron ba silang sinasabing gano'n na nag-aalala kami, baka kami ma-expose, ganyan?
As of this time, wala pa naman po na nagsasabi. In fact, the there are teachers who are still willing to serve for the election.
Hmm.
Paano ba yan, Yusek, pagka absent yung teacher, yung mga ganito, ano naman yan, ano? Parang counted as sick leave, no? Parang they will continue to get their pay. No matter how long they become sick. Meron din po bang, I'm just curious, meron po bang limit yung kanilang sick leave?
Well, actually po, our teachers based on rules are not on vacation sick leave. They are on proportional vacation pay. But since the default is on a work from home, they just have to submit their accomplishment for the week, and that serve as their basis for the payment of salary. So that means that so long as they are not filing sick leave, uh, we have been paying their salaries as since
Mm.
the pandemic year. Opo.
Isaac, balikan ko lang yung unang tanong natin about granting this break, much needed break para sa mga guro natin. At ngayon niya, pinag-uusapan natin yung elections pa. Alam din natin tuwing may nasasalanta, yung mga paaralan apektado and so on. I guess my question is with regards to the quality of the health assistance and mental health support in particular that we can afford to give our teachers other than granting them breaks and leaves. What kind of support is in place as well for their mental health?
Well, we have several activities, the psychosocial and mental support through webinars, and we're providing them opportunity to get in touch with the rest of their co-teachers with the theme Stronger from Home. Several MPHS activities have been conducted, and that's more of uh, webinars and other assistance and support.
Okay. Undersecretary Wilfredo Cabral, NCR Regional Director for the Department of Education. Sir, maraming salamat po.
Salamat din po.
Thank you, Yusek.
Salamat din po.
And we will need to take a break. Please stay with us. The Chiefs will be right back. Welcome back the Chiefs here on One News. Ako po si Robbie Alampay. Kasama po natin si Lucy Cruz Valdez and Ami Pamintuan. And now joining us, Octa Research Professor Guido David. Professor Guido, welcome once again.
Hi,
The Chiefs.
Professor.
Professor, good evening.
Hi, good evening, Robbie, Lucy, and Anne.
Okay, so Professor, today 37,000 plus, again another record. Although we have to note, diba, there was a time when nagdo-double tayo every day, then it started to go 30%, started to go 20%, now what 10%. Is that necessarily a trend or masyado maaga pa rin?
Well, it is a trend, pero if we're looking at NCR, kasi it's there's a discrepancy with what's happening in the NCR and in the provinces. So in the NCR, actually, it's slowing down. So if we're looking at the daily growth rate in the NCR, it's now just 3%, which is very good. It could mean now we're close to the peak in the NCR, or we may be peaking already. Kaya lang, in the provinces, it's now accelerating in many parts of the country. So in fact, I'm about to tweet now, so we're seeing Lucena, Naga, Santiago, they're already at critical levels. So mataas na, even compared to the Delta surge that they had. And many are already accelerating. So this is definitely a concern. And kaya yung overall numbers, it's not increasing that much. Kasi NCR is sort of peaking or plateauing, ganun din sa Calabarzon. But the others are starting to accelerate. In fact, it used to be yung NCR was accounting for 60% of the national number, pero ngayon it's only at 46% na lang.
So we're plateauing. I mean, is that what you're saying? We're now, mukhang the figures really show that we're now plateauing, and so the next phase will probably be a downward trajectory.
In the NCR, we could be plateauing. But why are there, bakit maraming disclaimers? We could be, it's not certain. Firstly, yung trends, I mean, when you're peaking, or when you're reaching the peak, you won't know usually until after it's peak. Kasi pag pababa na, pag downward trend, that's when you know na that was the peak. Pero once you're still there, you don't know kung yun na yung pinakamataas, baka tumaas pa. So that's one part. The other aspect is that, I mean, there are two other aspects. One is, as we mentioned, we're beginning to lose visibility of the situation because of the high positivity rate, greater than 50% in NCR. And then there's the third factor that makes kami mga disclaimer kami. The Department of Health actually hasn't updated their specific data set since January 10, and this is the first time. They're releasing the total numbers, total numbers, and then they have breakdowns sa website, but they used to have, or they should have this Excel files. This shows the positivity rate. You can get the information on positivity rate, on healthcare utilization, and other information there, like other LGU. And it's not been updated since January 10. This is the longest time it hasn't been updated. So
Bakit
we're,
po?
bakit hindi na-update? Bakit hindi na-update?
yeah, maybe pag mag-guess niyo yung mga USEC or DOH, maybe you can ask them because this is
there's another problem na in-acknowledge actually ng DOH, which is hindi daw nila nire-record yung results ng antigen testing. And maraming tao na, as we know, nagpa-positive sa antigen, hindi na tumutuloy ng RT-PCR, nag-home isolate na lang. At sila na lang ang nagagamutan dun sa bahay, di ba, pag nagkakahawaan. How big a problem is that?
Well, I mean, it's a part of the problem kasi we're definitely the numbers we're seeing is not the actual number, and how it's lower than the actual numbers of infections, especially in the NCR. How much lower? Yung antigen testing, we can estimate na because of local government data, it adds about 20% to the number. Pero how about those who don't test and yung mga iba may symptoms, they don't.
Iinom na lang ng biogesic.
Right, yes. And mag-home isolation. I think we could estimate it could be 3 to 5 times the actual number. I mean, I don't want to talk about it. I don't have data
3
to
to 5
support this,
times.
but
It's a lot, huh?
it could be 3 to 5 times.
But Prof, balikan ko lang yung yung sinabi niyo kanina problema sa data ng DOH. One is you said that this is the longest that they have not updated it. So I guess my first question is on the premise that this has happened before na hindi na-update. What were the usual reasons kung ba't hindi nila na-update yun?
Yeah, I mean, I think it happened before, Robbie, they weren't able to update it. Maybe 1 or 2 days the delay siya. And yung reason was because they had technical problems with the COVID kaya. And they stated that as such na may reasons sila. Okay, parang we apologize, we don't have the, because we're having technical glitches. But I'm not sure if there has been any notification or memo na they're having difficulties. I mean, I haven't been paying attention, but I haven't seen anything or nobody has told me na may memo na ito yung reasons kung bakit walang update. But this is a major concern kasi we get the positivity rate, we get the healthcare utilization from that data set. Meron tayong healthcare utilization sa website, but it's only the total number for the entire Philippines.
And to be very clear, the only context right now that we can establish is whether, or I mean, as you said, it's not there. We're just trying to establish the context of why. We certainly will ask, as you said, the next time we have an opportunity to get somebody from the DOH. But have you asked? Have the community of researchers asked, and has there been any explanation on that?
Well, I don't know if it has been asked. I mean, I've been personally busy working with the numbers, so but we have been talking yung mga Opta Research Fellows, some of the doctors in the doctor co, and I'm not sure. They don't even know then. We are just talking about, okay, kailan kaya mag-update yung DOH? Because, it's really, I mean, aside from the high positivity rate, this is really reducing our visibility of the situation.
Right.
The positivity
And I was going to ask, what are the practical implications of this, that we don't have full visibility?
Right, yes. We don't have full visibility. Isa na nga yung the fact that the positivity rate is very high, we're losing visibility. But this one, we don't have visibility on the healthcare utilization. Napupuno na ba yung mga ICUs? Because we are not seeing the data. How about the positivity rate? How about the positivity rate, not just in the NCR, but in provinces where they're starting to see a surge in cases? I mean, and I mean, on Twitter, some are asking me, is this a technical difficulty or is this actually intentional? I mean, I don't want to think it's intentional, but some people are asking that there's some intent to, I don't know, not to have these updates. I mean, I'm not asking it. I'm just saying some people on Twitter are asking me that, and
Could it be the sheer number of cases and the well, yun na nga, yung pagdagsa ng mga testing na kailangan gawin, and the fact that really practically all agencies of government and even the private sector are affected, no? So kulang na ng mga workers, medtechs, health workers, etc. Could it just be that the whole system is also overwhelmed? We're not just talking about the hospitals, but the whole system is overwhelmed. Could it be that?
Yeah, Luchi, we were thinking about that possibility. They're overwhelmed. Maybe some of their employees are down with COVID. I mean, we're hearing it from all sectors. I mean, even in the media, I've been hearing about some anchors, I mean, exposed or something. I mean, in some of the major networks, may backup anchors na sila, or the backup anchors because they're running out of anchors. But it could be an explanation. Kaya lang, sinabi sa akin ni Dr. Benjamin ko na, I mean, if they don't have the breakdown, they shouldn't have even the total number of cases. Kasi yung total number nila, like guys, sabi nila ngayon, 17,081 sa NCR. Yeah, they have that information somewhere there. I mean, because they get that also from, validating the test results. So, ibig sabihin,
Yeah,
it
in
could be,
other words, in other words, it does seem, or at least there, you would reasonably think that this was a selective release of data.
yes, parang ganun nga, Robbie. So I mean, we don't think na the data is not available. It maybe there's a technical error, baka na-overwhelm yung computer system or something. I mean, that's possible, but I don't think it's about, for example, the manpower per se. And besides, it's already been 4 days since the last.
How do you get your data from them? But do you access or can you ask for them?
It's actually,
You ask
I mean,
You
it's
access them.
publicly available. Yeah,
Yes.
there's a link
Yes.
sa website nila, and you can just click on that, and we would download the Excel files and then extract
Yes.
the data from
But
the
there
Excel
has
files.
never been a time when you had to ask. Halimbawa, may ganyan ngang gap. Can you ask?
Well, we can try, Siguro. I mean, we can try with some of our links sa DOH. Maybe I can ask si Beverly Ho or something. Yeah, so maybe that's one possible way. Kasi yun nga, I mean, yeah, we're trying to monitor the situation and we don't have visibility. It's very, I mean, we can't even confidently say na, oh, we're at the peak, because normally before we're more confident because we can cross-check with other indicators, positivity rates
Okay.
and healthcare. But now
Right.
we're kind of handicapped by this.
So you will,
Okay. In
you
the
will
meantime,
try-
Professor, balikan po natin yung modeling nyo, particularly for other regions outside of NCR. Gaya nga po ng nabanggit nyo, medyo nagde-decelerate sa NCR, but tumataas sa iba. Pero yung pagtaas sa ibang regions, there are two important factors there. One is mas mababa ang vaccination rate in other regions, and also those other regions, almost by definition, have less medical facilities than NCR. What do these mean in general for your projections and modeling for other regions?
Well, definitely, if we have regions with low vaccination coverage, there will be higher number of hospitalizations and deaths for unvaccinated people. That's just based on data from other countries. So far, we've been fortunate sa NCR and maybe Calabarzon na most of the people are vaccinated. So yung mga karamihan natin natamaan, that's why we're seeing 98% cases are mild, and just a small, very small fraction are severe or critical, and that will lead to a low number of deaths. Pero outside the NCR, well, right now we can only monitor yung mga highly urbanized cities because these are the ones available sa website ng Department of Health. But we cannot monitor places like Dumaguete or even other municipalities that are more rural, and that would help us identify kung saan nagkaka-surge sa isang area na relatively low vaccine coverage, because usually, based on what we're hearing, yung mga rural areas are the ones with lower vaccine coverage compared to the urban areas. Ito mga urban areas, we expect that they will have high levels of vaccination, like Cebu City, Davao City, and these are the ones we can monitor. But yeah, the cases are accelerating in many of these areas, like sabi ko, Davao City, Cebu City, it's already increasing there in Lapu-Lapu, in Iloilo City. So, but these are again highly urbanized areas with a higher vaccine coverage. So we expect na maybe most cases there will be mild as well. Pero yun nga, mga rural areas, we don't have that data because that's connected to yung kanina natin na pag-usapan na not updated since January 10.
What yung 40,000 na sinasite mo na maaaring peak, yun na kaya, or that we will probably rise to 40,000 in the next few days, no? You have said that. But, what do you think will be the peak of the peak? I mean, will it go as high as 60
Well,
before it
yeah,
becomes?
well, Lucci, as I mentioned also, then I think Ed could have mentioned that when I was interviewed. Once we reach a certain level, we lose visibility of the situation. because of the limited testing that we have. I think right now we're testing up to 80,000 cases per day, RT-PCR.
Yeah.
So yun lang nabibilang natin yung RT-PCR testing. And if we exceed 80,000, we won't see that's excess of 80,000 unless they can stretch the testing capacity. Kumaga, you only have 80,000 tests per day. If you have 80,000 cases, or if you have 100,000 cases, di mo na matetest lahat yun. Some of them will now become backlog or will roll into the succeeding day. So that's why it's, once we reach 50,000, we're starting to lose visibility. It's going to be problematic already. Now, can we reach 50,000? It's possible. Right now, that's why we're a bit conservative with the projections. I mean, I know some groups are throwing up numbers, because we're aware of the situation with the testing. I think 40,000, the testing can maybe handle that, but 50, medyo mahihirapan na. I mean, we might see 50. Of course, and like I said, I mean, in practice or in reality, siguro we have 5 times the number. If we have today 37,000, we probably really have 5 times that, or 4 or 5, 3 or 4, 5 times that.
Ganun
Maybe we have
kadami.
100,000 cases already. Yes. We can't really know for sure right now. Ginagawa nila in other countries after the pandemic, they do some serology studies, they check for antibodies, malalaman nila, ganun pala karaming nakawa ng Omicron. But we'll know it after the fact. Right now, I mean, it's just something that we just have to go through it.
Professor, is there any impact on your work, yung contact tracing? I ask kasi sinabi na ng Department of Health, dahil daw sa dami ng cases dito, hindi na nila pina-priority yung contact tracing. Although, i-focus pa rin nila yung contact tracing dun sa mabababang cases na lugar. Is there any impact on your work at all, on your projections?
Well, there is impact sa active case tinutulak ng Department of Health, because if you don't have contact tracing, you won't find other cases. So and because of the sheer number of cases, I could imagine that our contact tracing is probably already overwhelmed sa Metro Manila. In other words,
hindi na nga daw nila ipupush dito. Hindi na nila ipupush daw dito. Doon na lang sa mababang lugar.
Yeah, because hindi na sulit yung efforts eh. I mean, during good periods, even maybe even nung last week in December, we can still contact trace over 1:10.
Yeah.
Ibig sabihin, for each infected, 10 other people. Now, okay, you were exposed, 10 people. Right now, probably it's 1:1 eh. So for each person na infected, baka isa na lang makakontact trace nila. And if it's 1:1, most likely yung one person na makakontact trace nila with their resources ay member ng household, so it's useless na rin. And you just assume that persons in the same household are all infected. That's what I'm hearing anecdotally. I'm sure kayo rin narinig nyo. When one person gets it, yung buong household nila gets it, and yan. You just have to isolate.
Professor, linawin ko lang, no? Kanina sinabi mo nga, we're doing about 80,000 cases tests per day. That's RT-PCR. But is that the actual capacity? What's the maximum capacity as far as RT-PCR is concerned on a daily basis?
I think that's already capacity. I mean, they could probably stretch it a little bit. Maybe they could stretch it to 90.
But if I ask because if that's capacity, diba, 80,000, and we're practically just a little below 50% positivity rate, that means that the number that we're looking at right now is already hitting the ceiling of what can be visible to us.
Close to it, yes.
Sabi ni Yusek Vergere, ang capacity daw ngayon
100,000, di ba?
A day.
Oo.
At the height daw of Delta, they did 90,000 a day. So yun, sa ganong level, Professor, is that okay? Okay pa rin kayo nun?
Well, I mean, of course, more testing is better. I mean, siguro, I could buy they could stretch the 80 to 90 or 100. I don't remember na we hit 90,000 nung Delta surge. I thought it was mga high 70s or something when I checked it. Maybe mali pagka-check ko. But Is it enough? It may be enough in certain areas, pero yun nga, it depends
NCR,
on the
NCR, is that enough?
yeah, no, it might not. It might be okay for now because if we're already starting to have a downward trend, assuming this downward trend or this peaking
Yeah.
is genuine, then we might not need it na. But because because we are losing visibility, we're not sure if this is going to be a genuine peak that we're seeing. So is it enough? Parang we're there at the parang andun na tayo sa nasa stretch na talagang limits ng ating capabilities.
But how much catching up did I mean, how much time do you need to catch up on the projections, on the data once DOH puts it up? In other words, how much longer before we reach that threshold? Kasi 4 days late na ngayon, in effect, no? It will be 5 days tomorrow. Ano yung tolerable limit na beyond this ang hirap humabol? Or is it easy to catch up on the data?
It's easy to catch up, Lucci, on the data. So if today they publish the latest data, okay naman, we'll catch up, we'll update the models.
Okay.
So it's not really a problem of how long. Pero yun nga, right now, we're up, parang I mean, it's like you're in a tunnel, you can see, and then suddenly nawala yung power. Now you can't see anymore, and you're trying to find your way around it. So parang ganun ginagawa namin, trying to still make extrapolations sa models, still trying to project how many cases. Pero I mean, we really don't have a lot of visibility, and it may be almost to the point na parang guesswork na halos ginagawa namin, parang crystal ball na lang. Wala na, kumbaga, it's no longer scientific.
Science.
I mean, given that caveat, nonetheless, you did mention it's probably 3 times, 5 times more than what we're officially seeing. Now, of course, we always knew that, diba? Even before. We always knew na, of course, mayroong mga test na hindi kasama sa official. But what I'm wanna ask is, yung bang factor na 3 to 5, is that also going higher as an assumption compared to what you would assume before would be the real numbers?
Yeah, it should probably be going higher than before. I think I got the 5 times sa March surge last year. And we base it on when we look at the number of deaths, excess deaths, Philippine Statistics Authority. In fact, I'm writing a paper on this. Now, when we check the number of deaths, the actual deaths versus what was reported, it was about 5 times higher. And this number of excess deaths probably attributed to COVID, which means that the scale of the pandemic or that the number of deaths was actually much higher than we thought. And even if it's not 5 times, maybe it's 3 or 4 times, andun pa rin yun eh. I mean, that's because a lot of people died outside of hospitals or hindi na sila nakaabot sa hospitals. Most reported deaths are due to COVID are those who die in the hospitals. So ngayon, I mean, we're just using that as a guide, but it could be, some say that it could be even 10 times higher than the actual.
Because given that getting that from...
Oh, well, considering your diminishing visibility,
go on.
I think it's a good idea to implement the no vaccination, no ride policy. Kasi yun ang sinasabi nila, the virus containment. I know it's not your area, pero sa personal opinion.
Well, I mean, I always value personal freedom, but in a state of calamity or crisis, I think we have to adjust. And I mean, we're doing this anyway for to protect those who are unvaccinated. So I mean, my personal opinion, I think I would support measures or protocols that would prevent unvaccinated from getting infected, because they will be those who are most vulnerable.
Okay. Professor Guido David of Octa Research. Professor, maraming salamat po. Always a pleasure.
Thank you, Professor Guido.
Pleasure din. Thank you. Good evening, Robbie, Lucci, and Dan.
And that's all for this special edition of the Chiefs. We hope what was discussed here will keep the conversation going. Remember, mask on, wash hands, and stay safe, Philippines. Ako po si Robbie Alampay.
Hi, Mami Pabintuan of the Philippine Star.
And I'm Lucy Cruz Valdez of News 5, and we are One News.